many times when a patient smiles, and this is something that I think unfortunately is missed sometimes, is that they would ideally have a longer tooth, or they would have a long, and so, but when they smile, there are these people that sometimes when they smile and their tooth looks short, but they're showing a lot of gum. In order to improve that smile, the way to do it is not by lengthening the tooth, because by just adding to the end, then all of a sudden now their tooth is actually too long, but they're still showing a lot of gum. So by crown lengthening, you're actually able to raise the level of the gum tissue, which exposes more of the tooth that's underneath. So you're able to achieve a much more aesthetic looking tooth. So instead of now a square, it's getting to its more rectangular. Granted, there's curves and other things that soften that rectangle. But now when they smile, they're not only showing less gum tissue, but they're actually showing a more aesthetic smile. So that's a really nice way of being, and sometimes you're able to do that without even having to come back and place a restoration, such as a veneer or crown, because for whatever reason, sometimes patients' teeth don't erupt all the way, or when they did erupt, they tended to bring some of the gum tissue along with it. So sometimes it's a very simple procedure, just numbing them up, going in and removing a millimeter or 2 millimeters, which doesn't sound like a lot, but with a tooth, if you're able to increase the length of it, especially if it's short by a couple millimeters, it makes a huge effect. So you just contour the tissue, and then other times you're able to just contour the tooth. If you want to soften the way it looks, sometimes people want what's called, what I would say is a stronger smile. They don't like all the curves, or they don't like they call these little bumps on the end of the teeth, which the fancy name is called mamelons. And that's just, sometimes people have a bite that they don't use the edge of their teeth, and so they end up having these 3 little bumps on there. They'll come in and go, I want those gone. I would just like those to be flatter. So very conservatively, you can just recontour the enamel and get a nicer looking tooth, or get a patient that's happy, because it's, some of it is subjective. What you would maybe want on your tooth is different than what I would want. And the other thing that comes back to the listening part is that what do they want? What is it exactly? Putting that mirror in their hand and having them describe what it is that they would like to see.